Knowledge is power, and you need to know about a disease well before you be able to manage it well. Some people are not just ignoring treatment or refusing treatment, it is because they did not have enough knowledge about that disease. In today's video, I'm going to tell you the types of hypertension and what causes those types of hypertension or what can predispose you to those types of hypertension. Hello everyone, welcome to my YouTube channel, Ask Your Nurse. If you're seeing my video for the first time, I'm Ashamu Uluwashion. I'm a registered nurse, registered midwife with a Bachelor of Nursing Science. This channel focuses on content related to health, and thank you for stopping by. Don't forget to like, subscribe, and hit the notification bell below to be the first person to know anytime I upload another new video. And to my returning subscribers, thank you guys for all you do. Now, what are the types of hypertension? We have the essential or the primary hypertension and the secondary hypertension. The essential or the primary hypertension is the most commonest type of hypertension that we have, and it accounts for about 90 to 95% of all cases of hypertension. The onset is gradual, it does not start just one day, it begins to increase and increase until it gets very high, and the cause is unknown, but there are many factors that can predispose you to having this type of hypertension, and one of it is age. As you advance in age, you are predisposed to hypertension. Why? Because as your age increases, the elasticity of the blood vessels reduces. Normally, when the blood is flowing through your artery, the artery is elastic and begins to expand and give space for the blood to flow through it. But as you advance in age, these blood vessels become a little bit rigid. They do not expand easily. So the heart will need more pressure to push the blood through those blood vessels. So that is what can predispose you to hypertension as you age. Now another one is heredity. Hypertension is hereditary. It runs in the family. If your parents have hypertension, you are likely to have hypertension because you inherit it from your parents. As children inherit their parents' stature, their parents' beauty and intelligence, so also they inherit diseases from their parents. You can inherit hypertension from your parents. So once your parents have hypertension, look out for hypertension. Now another one is gender. Hypertension is common in men than in women, but studies have shown that women tend to seek treatment and tend to control their hypertension than men. So men, look out for your hypertension and seek treatment. Then another predisposing factor to hypertension is diet. Diet, when you are the type that take high salt, you take too much of carbohydrate, you take too much of fatty food, you are predisposing yourself to hypertension. So diet too is one of the cause or one of the predisposing factor to hypertension. Or your diet is low in potassium, you are predisposing yourself to hypertension. Another predisposing factor to essential hypertension is sedentary lifestyle or inactivity, where you are not active, you just sit in a place, you are not physically active, you are predisposing yourself to hypertension. And another predisposing factor is obesity, where you are overweight, you are giving your heart an increased workload to do, because the heart is like the owner's fist. When you fist your hand like this, that's the size of your heart. So that it is that small size that pumps blood all over your body. So when you are slim, it is the same heart that pumps the blood all over your body. And now imagine when you get fatter, it is that same heart that pumps blood all over your body. So when you are getting fatter, when you are adding weight, you are adding workload to the work of your heart. So you are overworking your heart. So being obese predisposes you to hypertension. And another one is smoking. Smokers are at higher risk of hypertension. The studies suggest that when you smoke, that a cigarette can increase the blood pressure by as high as 20 millimeter of mercury. The systolic pressure can increase as high as 20. That is so high, and it can stay at that level for up to 20 minutes before it comes down. Now imagine, because smokers don't used to smoke a stick per day, real smokers. So assuming you now smoke all through the day, you smoke in the morning, you smoke in the afternoon, you smoke at night, that means your blood pressure will remain at that high level throughout the day. So when you are smoking, you are at a very high risk of developing hypertension. So another one is alcohol consumption. Alcohol consumption predisposes you to hypertension, and another predisposing factor is stress. Stress can make you to have hypertension. When you stress yourself, the body is stimulated to produce stress hormone, and these stress hormones, they are vasoconstrictors. They constrict the blood vessels that are carrying blood. They become narrowed. So instead of blood to be able to flow freely through them, it becomes difficult for the blood to flow through them because they are narrow, they are constricted, and that stress hormone also increases the heart rate. So now imagine when you continue to stress yourself every day, your blood vessels are constricted every day, your heartbeat and is increased every day, and when it continues like that, you develop hypertension. So those are the risk factor to this essential hypertension. So take note of it and change and modify your lifestyle. Now, the second type of hypertension is secondary hypertension. This type of hypertension, unlike the first one, the cause is known, and this type of hypertension usually occur because of the underlying medical condition. It is the underlying medical condition that causes this type of hypertension, and once the underlying medical condition is removed, this hypertension goes. And what are now the causes of secondary hypertension? The number one is chronic kidney disease. Anybody that has chronic kidney disease will have hypertension. Another cause is diabetes mellitus. Those that have diabetes mellitus, they have hypertension. In fact, they are like twins. When you see somebody that is diabetic, you see the person having hypertension. And also endocrine disorder like hyperthyroidism makes one to have hypertension. Then another cause is drug like corticosteroid drugs. All these corticosteroid drugs like prednisone can cause hypertension, or all these hormonal contraceptives, they can cause hypertension. Now another one is pregnancy. There are some people, they develop hypertension during pregnancy. It is called pregnancy-induced hypertension, and immediately they deliver like this, the hypertension goes. So those are the causes of hypertension. So take note of it, and anywhere you need to change your or modify your lifestyle, ensure you modify it so that you'll be able to live a healthy life and prevent complication of hypertension. Thank you so much for listening, and I hope you have gained one thing or the other in today's video. Please don't forget to comment and ask questions in the comment section below. Please subscribe, hit the notification bell below to be able to know anytime I upload another educative content like this. Thank you so much. Bye bye.